Apolipoprotein C3, and angiopoietin-like protein 3, inhibit lipolysis by lipoprotein lipase and may influence the secretion and uptake of various lipoproteins. Genetic studies show that depletion of these proteins is associated with improved lipid profiles and reduced cardiovascular events. So it was anticipated that drugs which mimic the effects of loss-of-function mutations would be useful lipid treatments. Angiopoietin-like 3 inhibitors were initially developed as a treatment for severe hypertriglyceridemia, including familial chylomicronemia syndrome, which is usually not adequately controlled with currently available drugs. However, it was found angiopoietin-like 3 inhibitors were also effective in reducing LDL cholesterol, and they were studied in patients with homozygous familial hypercholesterolemia. Evinacumab targets angiopoietin-like 3 and reduced LDL cholesterol by about 50% in patients with homozygous FH, and it has been approved for that indication. The antisense oligonucleotide vupanorsen targeting angiopoietin-like 3 was less effective in reducing LDL cholesterol in patients with moderate hypertriglyceridemia, and its development has been discontinued. But the small interfering RNA, ARO-ANG3, is being investigated in phase 2 studies. ApoC3 can be inhibited by the antisense oligonucleotide volanesorsen, which reduced triglycerides by more than 70% in patients with familial chylomicronemia syndrome, and it was approved for familial chylomicronemia syndrome in Europe, but not in the United States because of concerns about thrombocytopenia. Olezarsen is an N-acetylgalactosamine conjugated antisense oligonucleotide targeting ApoC3, which appears as effective as volanesorsen without the risk of thrombocytopenia, and is undergoing phase 3 trials. ARO-ApoC3 is an cRNA targeting ApoC3 that is currently being investigated in phase 3 studies.